Good morning. I'm George Jones, the CEO of Bread for the City, and I have the honor also being the chair of the DC Primary Care Association Board, and it's my distinct pleasure to welcome you all to the DCPCA's Policy Forum this morning. Thank you all for being here. I also have the pleasure of doing some introductions, and the first thing I want to do, and every year I forget this, I don't usually forget to recognize the DCPCA board. I want to ask the board members who are here to sort of stand so you can help acknowledge their presence and their leadership of the organization. But I do forget to acknowledge the staff too often. And so I want to, everybody who works for the DC Primary Care Association, if you could stand up and be recognized this morning so I don't forget that. Thank you so much for your hard work, your dedication. So, found my glasses. Before I continue my acknowledgments, I want to introduce someone who's very special and we're really honored to have here. The recently appointed Director of the Department of Health, Dr. Yoexo Garcia. Dr. Garcia came to the Department of Health as a founding partner in 2 health consulting firms. Previously, he was the president and dean of the medicine at the Ponce School of Medicine and Health Sciences in Puerto Rico. Prior to that, he was assistant secretary of health at Health and Human Services and a 4-star admiral in the U.S. Public Health Services. Dr. Garcia has also served as a U.S. representative in the World Health Organization, Deputy Director of the World Health Organization's Pan-American Health Organization, Commissioner of the Connecticut Department of Public Health, and an obstetrician in hospitals and clinics in Connecticut. He brings an incredible amount of experience, both inside the DC government, but also clearly outside of the government. And so it's my pleasure to welcome him to the stage. Thank you for being here.
Thank you. Well, good morning, everybody. I'm going to be very brief. I'm still relaxing, so first of all, for me, it's an honor to be here in front of all of you. As a former primary care provider and as former community clinic provider, I work in clinics in Connecticut and also in Puerto Rico. And I also work in Afghanistan in clinics for women, so it's for me an honor to be with all of you here. First of all, I want to take also the moment to thank Jacqueline Bowens, the Chief Executive Officer of the DC Primary Care Association, for your leadership. And I look forward not only to meeting very soon, but also work with you and your team. And also George Jones, thank you, first of all, for the introduction and also for being a great board member. So I'm very impressed with the theme that you have for this policy meeting, serving patients in the new marketplace. And now with all the discussion in terms of the implementation of the Affordable Care Act, I think it's a great opportunity for primary care providers and public health officers working together. A lot of the traditional work that we used to do in clinics based on the public health department are going to be functions that all primary care providers and community health centers are going to be doing across our nation. So this is a great opportunity not only to support you even more than in the past, but also to work even much more closely with you. And before I forget, because I had been reminded by Lauren to make this announcement, and by the way, I agree with Mr. Jones to acknowledge the people, so I will ask the people from the Department of Health for DCs to stand up for a second, because these are the people that have done a lot of changes and support for all of you. So we are going to be launching in our website the DC Health Search Interactive Map, which is going to help people across the district locate our primary and specialty health services across the entire district. So I invite you not to look at it today because it's not there yet, but it's going to be very soon, and we will be sending notice to all of you, but it would be good for the patients and the people in the community to know essentially where our services are and to be able to amplify your message and work closely with you so that you can provide the services to them. As a community clinic participant in the past, I have been involved with many issues related to health disparities, and I also congratulate you for all the great work that you have doing here in the district, eliminating some of the disparities. But still, there's a lot of more work to be done. And I was looking at all the clinics from 2005 to 2010, and some of the new ones that are coming up now. I think I'm going to be in the launching of one in November, and then Unity in the beginning of the year. So I'm very excited about all the things that you have been doing here. I also, in public health, sometimes we don't talk about the accolades that we have done. I also want to thank all of you for helping the Department of Health here in the district have one of the biggest change in terms of the rates of HIV in the nation, in terms of improving the numbers. We have decreased HIV in the last 5 years by 46%, and we have decreased HIV secondary to IV drug use by 80%. And that's thanks to you. The condoms, we have distributed over 5 million. The needle exchange, I think, is an example not only for our nation, but for the entire world. And as a former commissioner of health and a former HHS and a federal person, I can tell you, you don't plan to have a decrease of 80% because you will assume that that's not something that you will achieve. So all of you achieving that, I think that we have to tell the world what DC is doing and what the clinics and the community health centers are doing. So again, thank you for all the great work that you're doing. And another thing I wanted to announce is the department is very, very interested to work with you to eliminate one of the things that is affecting our nation, but specifically the district, and it's infant mortality. We have some rates here that I didn't see in WHO. In countries in the region, I didn't see those rates. We have some wards that have over 12 per 1,000. And that's painful, because when we are talking about things that we can prevent, these are things that we have to work on them. We have partnered with the Clinton Global Initiative, the first time that happens in the United States, to work specifically with our department and with you, because this is not for us to capture the money for ourselves. This is for us to look with the partners in the district, meaning you, so we can actually go and identify the ladies, the girls, the women at risk, so we can actually give them a chance to have a healthy baby and a healthy pregnancy. And when I say this, it's that sadly some of these pregnancies, the infant mortality is secondary to infection and bleeding and hemorrhage. These are things that, again, that even in medical school, and we know this from medical school, you're not even planning for a baby to die anymore. And this is still happening in the district. We have asthma, we have diabetes, we have obesity, and the district is doing a lot of great things. So again, I don't want to stay with the microphone because I can continue talking forever, but I think that you're going to see me in the communities. So I hope you send me an invite, otherwise I'm going to show up there. And work with all of you. And I also want to acknowledge Mila's work in the exchange. I think we have a meeting tonight.
Yes, we do.
Yeah, exactly. For all the great work, the district has been ahead of the curve nationwide in terms of not only creating the exchange and enrolling people, but we're coming live in terms of having the healthcare done in January. We already started here, and we're going to be till March, the end of March, enrolling people, so we need your help as well. So thank you for the invite. Thank you for the opportunity to serve with you, and God bless all of you.
And this is the place in my remarks that says, okay, now you say whatever you want to say. Well, thank you again, Dr. Garcia. We really appreciate you being here, and We appreciate the long-time relationship and partnership we've had with the Department of Health and look forward to, as you said, sort of continuing that partnership. I also want to say that in a lot of ways, I know there are a lot of faces in the audience that I recognize as having been to a number of our annual meetings. We really appreciate the partnership that you have with us and that we've enjoyed with you in our efforts to, as we say at the PCA, to not only sort of ensure that there's access to health care, but that the disparities are eliminated. And so Dr. Garcia talked about the challenges, both the good and the bad, that the district has sort of experienced in the recent years and in long-standing years, really, around some of the things that we've gotten better at, HIV and using newly exchanged in creative ways, and some of the things where we still struggle in terms of infant mortality and some of the other negative health indices that we find too often present in lower-income communities. So one of the things that I wanted to point out today is that, as sort of an obvious thing, is we're in the midst of change. Of course, healthcare change is all around us. I mean, literally, the Affordable Care Act sort of kicked into full gear October 1st, and this whole challenge of navigating the health benefits exchange, of course, is one of the things that's on everybody's mind. Many of the clinics have put in systems in place to sort of help with that process for folks in the community who come to our clinics. And my sort of thinking about that is that it's going to be really important over the coming months and years for the stakeholders and the community members to really sort of help the district figure out how to make sure our system is the best system in the country. We've already talked about how we lead the way in sort of health justice in a way. I mean, we don't have the outcomes we want, but the efforts, and thanks to a lot of you here, the efforts that we put in over the last 15 plus years, this DCPCA has been around for 16 years, and the effort over all those years has really been sort of ahead of the class in terms of what is going on nationally. And we have the lowest uninsured rates even before the ACA was put into place. And so, yes, we should definitely feel proud about that. But we've got our work cut out for us. And again, I just want to reiterate how important it is going to be for us to continue to work together. And so that's one of the things that is about change. The other thing that I wanted to highlight is that, of course, we've changed sort of the name from just being an annual meeting to being a policy forum. And that's both sort of about what is going to operationally happen today. We've got two panels today that are going to talk about and sort of get at some of the sort of policy issues that are related both to the Affordable Care Act, but that are related to just access to health care in general. So I hope you hang around for those panels. Look forward to meeting with them. I know on one of the panels, the second panel, we actually have one of our consumers, one of the patients from Bread for the City, who will be speaking about his own patient experience. So engagement is one of the real things that I think both across the city we're trying to sort of really perfect in the healthcare community, this engaging patients in our work. But certainly at the PCA, we're prioritizing that as a way to really change both sort of things like access and certainly the more important things like the outcomes that our patients experience when they come to our clinics and to any healthcare entity in the city. You know, I was trying to think of the obligatory story that you're supposed to tell, and you know, the thing about healthcare, I'm reminded this isn't a new story. You probably heard it before, or a parable, and it isn't specific, or it isn't sort of solely related to healthcare. But it does remind me of. I am reminded of the parable where, in a village, you've got women who largely, who are at the end of a waterfall, and they go into this waterfall because they're catching babies. Their job is to figure out and to catch these babies and to care for them. And one baby after another just comes over the waterfall. And they catch them and they take them and swallow them in, sort of clothing and put them in a basket and make sure that they get taken care of. And the whole village takes care of these kids. But finally somebody says, you know what? We need to figure out why all these babies are coming off of the waterfall. And so somebody finally goes to the front of the waterfall and tries to figure out what's causing all these babies to fall over. And in a lot of ways, I feel like in the 16 plus years I've been involved in healthcare in the district, we've been catching a lot of babies, literally and figuratively, trying to make sure that we're taken care of. But obviously the real challenge is to prevent that from happening. And the PCA wants to be a real catalyst for that in the coming years, as we feel like we've been in the past years. And so again, the last thing I want to say, at the risk of being redundant, is to say that we really welcome a partnership with the Department of Health and all of the stakeholders and healthcare advocates who are here in that partnership of figuring out not just how we can catch babies and help take care of them, but how we can figure out how to keep them from coming over that waterfall at the beginning. So thank you for coming again this morning. The last thing I get to do is, it's my privilege to introduce to you for the first time a new introduction for me, but really just sort of you're meeting an old friend, many of you. But I'm so pleased to introduce the head, the leader of our organization, Jacqueline D. Bowen, who's the new CEO of, I guess for 4 months now, roughly, almost 4 months, of the DC Primary Care Association. We're so excited about it. And before Jackie comes up, I want to tell you, for those of you who don't know, who she is and how she came to us. She has been in healthcare, an executive and an advocate for 20 plus years, managing external relations and strategies, operations in the nonprofit sector. She recently served as Executive Vice President and Chief Government and External Affairs Officer at Children's National Medical Center here in Washington, D.C. Earlier in her career, she was on the Hill, U.S. Congress, where she had a number of accomplishments in analysis and development and implementation of legislation and policy. She's spoken nationally on a number of advocacy and public policy issues related to access to care, reimbursement strategies, and community partnerships. And that's why we have brought Jackie on to lead our organization, because those things are at the heart of what we do at the DC Primary Care Association. So again, it's my pleasure to introduce, and for some of you reintroduce, Jackie Bowen, the new CEO of the DC Primary Care Association.
Wow. Good morning, everyone. So wonderful. It was my first, I'm so happy to have you all here, and it was my first experience with a breathologist, and that was like so cool. I was like, Jackie, please don't fall asleep. That was just like, all I could imagine was like a YouTube moment. But I cannot tell you how wonderful it is for me to be here today, and I really want to thank George and the board for not only bringing me on board, but really to also acknowledge all of the hard work that you all have done with DCPCA over the past 16 years to get us to this moment, to get us to a moment where we really can not only be there to catch the babies, but to ensure that they don't fall over the waterfall in the first place. And I promise you that is my commitment to work with you so that we will get there. I mean, we are going to get there. And so I thank you for the opportunity. Dr. Garcia, thank you so much for being here and being here this morning. I know today is a very busy day and some very exciting and worthwhile things are going to be going on soon. So I really appreciate your taking the time to be with us today, and on behalf of our association, really looking forward to the opportunity to work with you and your entire team. I've had the pleasure of working with many of them in my former life, and certainly I'm one who doesn't give up on anything, and so we left a lot of things on the table, and so we'll continue in that regard. As George mentioned, I am fairly new to this position. I promised my team that I would stop counting the days. I know what they are, but I made a promise, and so I'm going to stick with it. And as George has mentioned, I have worked previously at Children's National Medical Center, and I had experience on Capitol Hill, actually. One of the initial founders of the Congressional Black Caucus Health Brain Trust, and working with that, and that's another element. So proud to have had the opportunity to work there. And it's just so great to see many of my old friends and have an opportunity to connect with some new friends. And so great to meet you, and looking forward to a whole new host of relationships and collaborations. And this in some way is a bit of a homecoming for me, and I really mean that in every sense of the word. As some of you know, I may have a few little type A tendencies, not too many, but there have been a couple of things in my life that I've had absolutely no control of, and those are two things that I'm really, really proud of. First one is to be born into the family that I have the blessing of being born into. And the second one is to be born in Washington, D.C. And so my great-grandfather migrated here in the 1920s, and he along with his wife and his young son, who happened to be my Gramps. Everybody calls my grandfather Gramps. You can be 80 and call him Gramps. You can be 90 and call him Gramps, and he's 94, and he'll be 95 next week. And so he migrated here with his family in the 1920s, and he married, my mom was born here, and all of her siblings, and all of my siblings, and all of my kids. So Washington, D.C. is certainly home, and it's great to really have this opportunity to work with DCPCA and really be on the forefront and on the front lines of the great work that they do, and that I now get an opportunity to participate. Through my entire career, you know, I really have been dedicated to the pursuit of equal access to care for all, no matter who you are, no matter where you come from, no matter what you do. Each and every person deserves the right to quality health care. And I'm so privileged to have an opportunity to really participate in a movement that will get us there. And so I thank the board once again, and I thank my team for the opportunity to work together in that direction. I know how far we've come in the last decade, and as you've heard before, while lots of progress has been made, I think each and every one of us realize that so much more needs to be done. And Dr. Garcia talked a little bit about some of the indicators. I'll talk a little bit about those as well. I think what you're going to hear from me, and you're going to hear from our team, and what you've heard from our board, is that as much progress as that we've made, there's so much more to do. But DCPCA can't do it alone. What we're about, we're going to be about partnerships. We're going to be about collaboration. We're going to be about networking to really help us get to that new phase. One of the things that I am proud of, can I get some water? Excuse me. One of the things that I'm also proud of and pleased is that I have a team who certainly have been a part of the movement as we've gotten to this far, but really dedicated to really working together and working in partnership with many of you as we begin to tackle many of the changes that we are already beginning to experience in this new landscape. So I again want to acknowledge our team. Many of them are here today. They have been hands on deck. They've been working very, very hard on this program to bring this agenda to you, together with our planning committee, which includes many of the members of our board and our health centers. So I want to stand here before everyone and salute them. I'd also like to thank you so very, very much. I've been talking so much. I need a little. This is not a Ted Cruz moment, though. I love Republicans. Not. But anyway, I would. Every now and again you get to be a little partisan. I try most of the time to be bipartisan, but these last couple of weeks have been a little difficult, even for me. I'd also, again, like to take a moment to acknowledge our health center leaders in addition to our board, and would once again like to ask them to stand up to be recognized for our group. We've got several here, and there may be others in the back. And as Dr. Garcia said, we really want to thank them in advance for the critical role that they're going to play and have played, particularly in the implementation of the Affordable Care Act, particularly given its very strong emphasis on primary care. And it really is through the work of our health centers that brings voice and focus to the work that we do. You know, my job is to really be that voice on behalf and see things through the lens of our health centers. These guys are absolutely phenomenal, doing fantastic work, and I cannot say enough. I cannot say enough about the heroes that you all are and that your teams are. So, and if you haven't really had an opportunity, and I'm just going to put this out there, I didn't ask their permission before, but if you haven't had an opportunity to really visit one of our health centers and have an opportunity to walk in their shoes, I really would encourage you to try to take advantage of that experience because it is not only memorable, it certainly is one of those things that really touches your heart to see firsthand the great work that they do. As I mentioned before, we've been on the forefront of healthcare before it took hold and became the law of the land. And again, I want to just say, yes, just in case there's some elephants out there whose memories aren't quite working, it is the law of the land. And, let's stop holding the District of Columbia hostage and let's get on with it and allow us to continue to do the things that we need to do. I mean, I can't think of any better reason for home rule than what's going on today. And I know at 11 o'clock, many of you all will be joining the mayor to really bring that message home. And please give him my encouragement and best wishes in that regard, because it is absolutely ridiculous. Now, as you've heard, we're moving from visits to value and serving patients in a new marketplace, symbolizing our really long-term commitment to creating an integrated healthcare system with guaranteed access to primary care and health equity. We all know the problems, we heard them before: diabetes, hypertension, HIV, obesity, asthma, and many other chronic conditions continue to impact the overall health care and well-being and access of residents in the District of Columbia. And while our health centers continue to lead the way, and particularly in managing some of these very chronic conditions, and I'm proud to say have some of the best practices in the nation around care coordination, patient engagement, extended hours, and meaningful use of electronic records and overall quality improvement. They truly do represent the best examples of medical homes. And as I said before, I'm really proud to have this opportunity to build upon that legacy. And there's no question that DCPCA has been at the forefront. And yet, as I've said before, there's more work to do. We look forward to continuing our relationship and our partnership with the Department of Health. The department has really been instrumental in working with DCPCA and our community to build primary care capacity. As you mentioned before, so excited about the growth and development of capacity since 2005 and the wonderful work that has been done, and also just more in the next few weeks with the Parkside Health Center opening, and soon after that, the Community of Hope facility in Ward 8. So we are out there, we've mapped the neighborhood, we have certainly are about not just building a facility and assuming that they will come, but being very, very strong in outreach and engagement and bringing services to families where they are, and understanding not only having a facility, but a facility that is warm and welcome and speaks to people in a language that they can understand. So that really is a commitment that we have. On display, you'll also have an opportunity to see the progression and the development of our medical homes project over the years. quality improvement continues to be, and technology continue to be a great emphasis for our centers, and we're very, very proud that we have extended our technology to over 1,000 doctors, positioning them for meaningful use. That is the work that DCPCA has done. That is what DCPCA has led on. And really proud to report, second in the nation in that regard. So great, great work. A lot of work with respect to engaging our young people and providing them with opportunities to have an experience in healthcare. Our AmeriCorps initiative in partnership with our health centers, again, a best practice and leader in the nation. We know that access to care begins with qualified caregivers, and so our longstanding commitment to community health workers, where we actually have people who are focused on the neighborhoods and working at the grassroots level to work to promote health, has been a phenomenal initiative, and we'll be soon rolling out an initiative. Prevention empowers me to train an additional 50 community health workers. So we're not only teaching people about health, but we're definitely attacking some issues around workforce development. Also, as many of you know, as part of the Affordable Care Act, a lot of work in terms of outreach and enrollment, and DCPCA is so proud to be a part of the Health Benefits Exchange initiative around in-person assisters, a great opportunity to not only be out in the communities, but also to work collectively again with our health centers. So I don't want to repeat much of the things that you've already heard from Dr. Garcia and George, but I have to ask myself, and I'm sure that question is out there for you, so what's next for DCPCA? And that's a question I've heard quite a little bit in my 127 days shared. I'm still in that phase. I have to be honest with you and say, I'm still in that phase of, I don't know what I don't know. But as that picture is becoming clear for me, and I've been able to be enlightened by many of the communications and the outreach that I've had the opportunity to have with many of you in the audience and my health centers. And as George mentioned, I've been equally awed by many of the patient stories that I've been able to experience as part of my own personal learning journey that I've tried to use to help me begin to think about the future of DCPCA, really trying to build upon the wonderful work that's been done in the past, and mostly figuring out, so what is that next big thing? What is it that we're going to do, and who are we going to do it for, and how do we best position ourselves to be what I think we all agree is to be that catalyst for change. And at the same time, I'm as many great things have happened, I constantly am reminded, as I mentioned before, about those barriers that continue to exist for many of our patients. And how can we really begin to show some measurable outcomes and improvements for our families. That, to me, is one of the greatest opportunities for us moving forward. We have the systems in place. We have the committed and dedicated teams. We've already demonstrated that we can be great leaders. So for me, my desire is to see a city where we're no longer thinking about all of those issues that continue to present themselves, and somehow or another we continue to manage to be at that bottom five, that bottom five of success. So why not just turn that thing upside down, and we need to be in that top five. And that's what we need to be focusing on, how we work together to be in that top five. And so when you hear about how we're doing in diabetes, and how we're doing in obesity, and how we're doing in hypertension, and thank God how we have done in HIV. So that's where we want to be. And it is my desire my goal and my passion to work with each and every one of you to get us there. And as I said before, it's going to be about collaboration, it's going to be about partnership, and it's going to be about engagement. Literally 5 hours after I had this wonderful conversation with a man named George, like my dad's name was George, and decided that DCPCA was the place that I needed to be, I took a moment to think about, well, what does that mean? And Jackie, what do you need to do? And I said to myself, it's about strategy, it's about engagement, and it's about sustainability. Those are the areas of focus that I believe for DCPCA that I need to begin to think about, and that strategy that will set the direction for us as we move forward. Engagement, which requires and takes into consideration the partnerships and the collaborations and working together. Just because I have an idea doesn't mean it's the only idea. It is us working together and figuring out sometimes who needs to lead, who needs to collaborate, and who needs to support. But at the end of the day, we need to focus and stay focused on how do we get to that top 5. So that's what my engagement was going to be about. And sustainability, ensuring that I have and we have the financial strength to ensure that we can make the appropriate investments that allow us to be creative and innovative to make a difference, to move the needle forward. So strategy, engagement, and sustainability, all wrapped around a collective partnership to help facilitate the direction as we move forward as a catalyst for change. Over the next few weeks and months, I'm going to be working closely with my board. I'm going to be working closely with you as we begin to think about that strategic direction and future for DCPCA. I am so excited and honored and pleased to have this opportunity at this time, at this amazing time of change in healthcare. I'm so pleased to have the opportunity to lead this wonderful organization as it continues to make a major difference as we move forward. And as I said before, I'm so looking forward to the day when people hear about our hometown, many of our hometown, and they never again think about us in terms of the negativity, but the positivity, and how we're working together to begin to address not only healthcare, but those social determinants that impact healthcare, and how we engage health and safety and transportation, and all those things that represent barriers to care for our people. So I'm hoping and know that today is going to be a wonderful day. It's my first annual meeting, and when I get done, Sherry over there is going to critique and tell me, Jackie, why didn't you do this? And Jackie, why didn't you do that? Never. But seriously, thank you all for being here. I very, very much appreciate the opportunity to both lead DCPCA and also to have an opportunity to once again work with many of my friends in the past, and also the many friends and connections that I look forward to developing moving forward.